This is an article that came out on U.S. News and World Report. Steep rise in deaths for people hospitalized after opioid OD. December 4th, 2017, and I will leave the link to this article in the description box. The death rate has quadrupled among people whose opioid use land them in a hospital, a new study finds. More opioid users are being sent to the hospital due to a life-threatening overdose than for treatment of drug addiction, the researcher noted. About 2% of people hospitalized for opioid use died in 2014, compared with 0.4% prior to 2000. The new analysis of federal hospital data reveals. The same analysis showed that hospitalizations due to opioid or heroin poisoning have increased in recent years, even as the rate of people seeking treatment of opioid addiction at a hospital has gone down, said senior researcher Dr. Zarui Song. He is an assistant professor of healthcare policy at Harvard Medical School. Before the turn of the century, most opioid-related hospitalizations were for treatment of opioid dependence and abuse. The more dire condition of drug overdose now has been taken over as the major cause of opioid-driven hospital admissions, Song said. You can see that primary diagnosis due to dependence or abuse gradually goes down, while primary diagnosis of opioid and heroin poisoning steadily goes up, he noted. Patients admitted for opioid or heroin overdose are also more likely to be white, middle-aged, from a lower income area, or being treated for a disability, according to Song's analysis of the nation's largest hospital inpatient database. One health policy expert found the findings troubling. The opioid plague has caught up people who haven't been traditionally involved up in heroin crisis in the history of our country, said Emily Feinstein, Director of Health Law and Policy for the National Centers on Addiction and Substance Abuse. Studies have been telling us that middle-aged white Americans are dying sooner, Feinstein added. We think this is a lot because of substance abuse, and this study confirms that. We're seeing opioid abuse partly driving that trend. An estimate, it really is 175, according to Chris Christie, who headed the Opioid Commission, but they have 91 here, but he already confirmed it's 175. Americans die every day from an opioid overdose, according to the U.S. Center for Disease Control and Prevention. More than 64,000 overdose deaths occurred in 2016, including more than 15,000 deaths from heroin and more than 20,000 due to synthetic opioids. Song's observation confirms that experts had suspected about the progression of Americans' opioid plague, which was sparked by increasing numbers of Americans gaining access to and becoming hooked on prescription painkillers, Feinstein said. We know what kicks this off is the misuse of prescribed opioids, but we also know this is not really driving the problem anymore, Feinstein said. The initial response to the opioid plague restricted access to prescription drugs, but didn't address the underlying issue of drug addiction, Feinstein explained. Drug users are probably suffering overdose deaths more frequently because they switch from prescription painkillers to more potent and more easily obtainable opioids such as heroin and fentanyl, Feinstein and Song said. Heroin, and especially fentanyl, which is even stronger form of opioid, present higher risk of overdose than conventional opioid pills, Sung said. Fentanyl can be 50 to 100 times more potent than heroin and often is cut into street heroin or illicit pain pills without the user's knowledge, said Dr. Tim Brennan, an attending physician with the Addiction Institute at the Icahn School of Medicine of Mount Sinai in New York City. Many more people are now coming into the hospital because they've been accidentally poisoned by their drug of choice, Brennan said. You think you're buying heroin, but more and more heroin is altered by fentanyl, which makes it more dangerous. Not only are more people using this product than ever before, but the product is more dangerous than ever before. However, another explanation is possible. More people might be getting community-based treatment for drug addiction, which means it's more likely they'll only wind up hospitalized for an overdose, Sung said. If you assume for a moment that lower severity cases can be immediately treated in the community or home or street setting, then on average, the people who end up in the hospital may, on average, be sicker, Sung said. The analysis also cannot account for people who might be dying of overdose out in the community, Sung added. Ultimately, these numbers show that addiction treatment remains woefully underfunded, Feinstein said. And guess what? It's going to stay underfunded because Trump said he ain't giving one dime. It is a public health issue, and he's not giving up not one dime. We need immediate, broad-reaching investments in good treatment. When people experience an overdose, at that moment, they should be going into treatment rather than released back into the community as if they don't have a deadly illness, Feinstein said. Well, it's nice that they define drug addict as somebody that has an illness. They didn't define it that way during the crack epidemic. Not enough is done. We could be preventing these deaths. The study was published in the December issue of Health Affairs. I tell you, it's not going anywhere, y'all. This is it for America. Please leave your comment and subscribe, and don't forget to hit on that notification bell. Peace, family.